Well, as the relations manager here at Sanctuary Functional Medicine, I get a lot of questions. How does a consultation actually work? I was wondering today if you could, Dr. Potter, present a clinical aspect of what a consultation looks like behind the scenes.
Yep, I'd love to do that. A lot of patients ask me that when I'm talking to them in meet and greets. So it's going to look a lot like any other clinic visit at first. You're going to fill out paperwork. There's forms to fill out. There's a history where we sit down and talk. There's a physical exam. So I use a stethoscope, otoscope, a lot of the same things any other doctor is going to use. However, it gets a little different after that point. The initial medical forms that I have you fill out, they're going to be a little more extensive. They're going to go into a little more about lifestyle issues, nutrition, exercise, your sleep. These may be things that your other doctors have not really delved into that much. You're even going to look back to your birth history. What things were you exposed to when you were a child? So you're going to spend some time filling that out, so that way when you get to the visit, I'm going to have looked over that and know a little bit about you, maybe even a lot about you before you even walk in the door. Once you walk in the door, we're going to sit down and we're going to spend a lot more time. A lot of doctor visits, maybe 20 or 30 minutes at most, sometimes even 10 or 15 minutes. At Sanctuary Functional, with me, you're going to get an hour and a half where we spend together doing a history and physical. Typically, that's 45 minutes to an hour of us just talking. I'm going to go into more depth on those questions that I ask on that initial form, and we're going to talk about what your story is. What is the story of your life that has brought you to sit in front of me? Each person is a little different. Some people, they've had some symptoms for a few months, but many of my patients, they've been suffering from things for years, even decades. That gives me a chance to really dig into those things, trying to understand what has led them to be sitting across from me. Then that physical is really pretty much going to be a head-to-toe physical. We're going to look at your nervous system, your skin, your heart, your lungs, a lot of those same things other doctors do, but there'll be a few specific things I'll look at, whether it's fingernails, skin, certain things about balance and reflexes that other doctors wouldn't. After that, we're going to determine what are the tests that are going to be helpful to figure out what's going on. You've come to me because you have unanswered questions. You have some suffering, something that is happening to you that you don't have an answer for. I can learn a lot from that history and physical, but then I use some lab tests to kind of fine-tune to get that last answer. I know it's one of two or three things. Then I can say, all right, let's do these tests to really find out what that is, and from there we can start therapy. So, history and physical, lab testing of that first visit, it's an hour and a half. You may spend another 20 or 30 minutes with a nurse setting up those lab tests. Then you come back for a second visit. So the consult is not just a single visit. At that second visit, we're going to spend another hour and a half. But not only that, I may have spent an hour or 2 hours looking over your test results, researching the latest studies that pertain to what your health problems are, so that when we come back, I may have already spent another couple hours, then I spend another hour and a half helping you understand about your health. So it's not just, oh, here, do this, take these 5 things, take this supplement, take this vitamin, take this medicine, go to this therapy. It's going to be, here's what we found, here's what I believe is going on, and here's what we're going to do about it and the reasons why. So that way, when you walk out the door, you're much better equipped to care for yourself.